A number of issues were discussed earlier today at the 9th sitting of the Consultative Forum meeting held at the NJS Francis Building in Grand Turk. The much-talked-about National Health Insurance Plan was up, and the Ministry of Health and NHIP representatives were a part of the session to answer questions from forum members. Residents of Salt Cay say they have been neglected in terms of health care on the island. Forum member Patricia Simmons had quite a few questions for the health representatives. Simmons questioned the benefits for residents of Salt Cay, being as there is no medical facilities to receive direct health care.
There is a Ministry of Health, a nurse, and I believe a visiting doctor on Salt Cay. In the event that the Ministry of Health providers, regardless whether it's Salt Cay, South Caicos, or the other islands, deem that it's a situation that needs to be referred to one of the medical centers, the National Health Insurance Board provides and makes arrangements for transportation to those facilities, whether it's in Grand Turk or in Provo. So we are trying to make it as convenient as possible to access those facilities when necessary.
Director of Health Services Rufus Ewing, also on that question, said family island clinics are the responsibility of the Ministry of Health, with plans in the making.
And it is the plan not to only engage in physical upgrade of the facilities with budgetary limitations, but also to provide telemedicine solutions within those facilities, so at least the persons living on the islands will have access to the physicians at the health facility, at the hospital, to make decisions on management and also transfer, so that at least the medical staff resident on the island would have some degree of comfort, and also the resident would have some degree of comfort that they have a higher level of expertise looking after them and making decisions on their care.
Simmons then responded, saying the island of Salt Cay has not seen a physician for over a month. Ewing said that situation will be addressed. And the healthcare team continued to be grilled. This time, questions came from the former Member of Parliament and Consultative Forum member, Karen Delancey.
Care management should take a more aggressive approach, that there should be a constant check on high-risk patients. To the team, what you're telling us this morning, this should have been communicated a while back, and I think we wouldn't be grilling you like this. First question is, what are the systems that controls the financing and delivery of health care? 1. 2, what are the major types of managed care plan? And 3, what role will generic drugs play in the healthcare services?
CEO of InnerHealth Canada, Roger Chessman, responds.
The project agreement requires that a minimum of 75% of all drugs dispensed are generics. That is something we are aiming for. That is something our suppliers are sourcing for us. The major type managed care plans, basically it's everything you would expect from diabetes through nephrology and dialysis, cardiological patients, the hypertensive. These are the basic care plans. But within the hospital, for every major type of program that you have, there is a care plan. For every admission that is made under these, there is a care plan for the flow of that patient through the system. Where there are variances from the care plan, they are recorded. Not all variances are negative, many of them are in fact positive. But all variances are audited, and the audits then give us some ideas on where we need to go with care plans. We are keenly aware that we are in an area where we have not worked before, and that there are some disease processes and indeed some other elements of care that are not common in other areas of the globe. And therefore we have to amalgamate all these as we learn about them into our care plans. So our care plans will change. Care plans are dynamic.
We will have more on the forum in tomorrow's newscast. For WIV4 News, I'm Takara Bain.